If you are a fan of the Olympus Saline Bipolar Resection System, you may want to listen up and watch what I'm going to say, because as you use the machine and the instruments, you may encounter this problem, which I recently did experience during multiple TURPs. For those of you who don't know me, my name is John Lin. I'm a urologist here in Gilbert, Arizona, also your humble host of the Thriving Urology Practice Facebook group, where we crowdsource practice management solutions for everyone's benefit. Okay, I'm a big fan of TURPs and TURBTs, and during residency, at the end of the residency, saline bipolar resection systems started coming out. Fast forward many years later, the technology has really improved and it works great until it doesn't. So recently I was doing a TURP, and this has been happening more and more as I perform transurethral resection of the prostate. During the resection, I would experience errors, and the specific error using the Olympus ESG 400 generator while using the Olympus medium thin loop resection loop. It's a 24 French loop. With that combination, I would occasionally get non-conductive fluid error. Non-conductive fluid error. So during the resection, you press the cut and then you will hear this boop boop error on the generator, and you can't continue. Your staff may reset the machine and then you can try to use it again. It sometimes will work temporarily for a few resections, few cuts, and few fulgurations. Eventually, you constantly get this error, and the error progresses and it gets worse and worse and occurs more and more frequently. Now, I have tried everything. I've tried switching out the generator, switching out the cable, going from the generator to the working element or the handpiece for the resection. I have replaced the resecting loop. I have replaced the resection sheath. I've tried pretty much everything. And of course, the first thing we made sure was we were using saline. So none of that worked. Now, this was at the surgery center, and the surgery center has been open for about 10, 11 years. They really take good care of the instruments there. So I didn't think that was going to be an issue. Now, this has continued to plague me until it finally quit. It would not resect anymore. Like every time I pressed the pedal, it would just not do anything. It would give me the error. So just to show you, the actual machine that I use is the ESG 400, and I was using software version 12A, and you can see the serial number and stuff like that on the bottom. It's a really recent update of the firmware or the software. And the settings that I use, 280, 180, effect 2, if that matters to you, using the saline bipolar resection setup in the lower left-hand corner, using the pedal that is typical. So that's what I was using, and it would give me the error. So some people have said, well, maybe the firmware or software needs to be updated. We actually got a new generator on loan from Olympus, and we used it, and it was still giving us the errors when we used the old, here's the solution, the old working element. It turned out that it was the working element that was at fault. And let me show you what a working element is. This handpiece, you may call it a handpiece, but it's called a working element. That part gets old as you resect a lot of prostates. It's a piece of conductive electric type of an instrument. It conducts electricity, electrical current, and you want to make sure everything is perfect. Now, what you can't verify whether that is working perfectly are the internals, the connections. Now, if you insert the working element into the handpiece, the part that clicks in, that is the part I think is the problem. And let me show you what I mean. Let me set that up. There we go. I have here a couple of working elements that have been used and cleaned and sterilized. These are 24 French Olympus, the genuine Olympus resection loops. As you can see, you may be able to see the tiny little print right here. This is These are Olympus, actual genuine Olympus loops. Let me zoom in on that. So these are actual Olympus loops. And if you notice, let me show you the ends, the parts that go into the actual handpiece. If you notice, the one on top, this right here, notice how that is charred. I think that's part of the problem. When the handpiece is old, it does not reliably create a positive connection to this portion of the loop, and that is what eventually causes a failure. Now, I never tried cleaning this area and then reinserting it back into the handpiece to see if it would correct the non-conductive fluid error, but that's something that you may want to consider using until you can get a replacement of this handpiece. Now, you can buy a new one, which may be more costly, or an alternative may be to send the old one in for Olympus to repair it or recondition it and then send it back to you. It's, as of this recording, it was less than $1,000. But considering the number of times that I've used the working element or the handpiece and how getting it refurbished and reconditioned, now I just performed the TURP this morning and it works perfectly. And also did TURPs last week. It also worked perfectly simply by replacing the handpiece. It is not the generator. It is not the cable. It's not the actual loop itself. It's not the pedal. I even tried that. But in actuality, is just the handpiece. This little piece right here, the element that you use to do the actual resection, that is the culprit. So don't waste your time. Don't spend energy pulling your hair out after all the trials and tribulations that we did to figure out this problem. It turns out to be the handpiece. So get that replaced, get that looked at, and possibly while you're in the middle of your resection, you may want to consider cleaning this part right here and then reinserting it back into the working element or the handpiece to see if you can at least finish the case and then finally get the handpiece repaired and or replaced. All right, any questions or comments? Leave them below. I hope this helps you with your non-conductive fluid errors using the Olympus Saline Bipolar Resection System along with the Olympus ESG 400 generator. By the way, I love the generator. I love the Saline Bipolar Resection System. It's really made TURP so much better, so much safer, and so much more efficient. My TURP patients go home the same day, and I can resect with the same speed as I could resect using monopolar, except I'm now using bipolar, which uses, as you know, saline as an irrigant. It's a lot safer for the patient, and you can take your time, make sure the hemostasis is perfect, and then the patients go home as an outpatient. The catheter comes out in just a few days. No overnight stay in the hospital, no prolonged bladder irrigation. So anyway, consider looking into it if that is something that you perform or your staff performs. Anyway, any comments or questions, as usual, leave them below. Take care and have a great one. Bye-bye.